We continue tracking coronavirus concerns at 5:30. Yesterday, the Rhode Island Department of Health announced changes to limit visitors in hospitals and skilled nursing facilities. The initial policy bans anyone under 18 from visiting those facilities, in addition to anyone who's feeling ill.
And new tonight, we've learned the Department of Health is upping those restrictions. Eyewitness News reporter Alexandra Leslie joins us now in studio with the update.
Well, after a conference call with skilled nursing facilities and hospitals, those leaders have been directed by the DOH, in addition to restrictions in place, to limit visiting hours altogether. I spoke with one nursing home earlier today about how they're adapting to the latest guidelines. The sound of hand sanitizer dispensers and seeing posters like these will become more common in skilled nursing facilities and hospitals.
And whether it's a flu outbreak or coronavirus, taking care of those residents is our top priority.
The Rhode Island Department of Health is working in coordination with hospitals and skilled nursing facilities like Scandinavian Communities in Cranston to help prevent the spread of coronavirus.
We know from what's happening, for example, in Seattle, that this disease hits those who are vulnerable the hardest.
The vulnerable population, according to health experts, are people who are older or have weakened immune systems. In Washington state, most of the 10 coronavirus deaths were residents of a nursing home just outside Seattle. Visiting policies in such facilities are now evolving.
We are screening visitors when they come in. We're asking them if they've traveled in the past 2 weeks out of the country. We're limiting visitors under 18.
You'll also be asked about your health.
If they have any of the following symptoms: sneezing, coughing, fever, or shortness of breath, and asking them not to visit.
Healthcare workers say they know it's important to visit loved ones, but keeping them healthy is most important.
Please wash your hand and use hand sanitizer. You keep safe so we can take care of your loved ones.
Now, the executive director at Scandinavian Communities told me a third level of protection against its patients and staff would be ending visiting hours altogether. She told me that the limited visited hours could take effect as soon as tomorrow. Live in studio, I'm Alexandra Leslie, Eyewitness News.